Welcome back, students. I'm sure you were safe and healthy all these days. Now, let's continue with our session of occupational hazards. Today, we will start the session 4. We have talked about the different types of hazards. We have classified them as physical, chemical, biological, mechanical, psychosocial hazards. We have tried to understand the effects of all the different exposures. What are the hazards? Now, let us talk about prevention and control. How do we prevent and control these hazards? It's a very important topic. Occupational health safety is a very big chapter in industrial medicine, which is part of public health. Safer work, better lives. Now, the hazard and prevention, unless you identify the different hazards at work, you are not able to prevent it. We have already classified them systematically, and just let us see the different exposures that we had talked about. Fumes, noise, ergonomics, biological hazards, extreme temperatures, vibrations, chemicals, and so on. Now, these hazards have to be prevented. So how do you do that? The common public health approach. Let us take up this, the public health approach to prevention. We have 3 levels of prevention. Primary prevention is promotion of health and prevention of diseases. So it is designed to avoid the occurrence of disease or injury. Then we have the secondary level of prevention, which is early diagnosis and treatment. So early diagnosis means you try to identify and adequately treat the injury process before it becomes a complicated hazard. Tertiary prevention. Now, when it has advanced beyond its early stages, to avoid complication, limit the disability, we have to address the rehabilitative and palliative needs, and this is the tertiary prevention. Now, how do we approach these 3 levels of prevention? We have different measures for that. Now, it is medical measures, engineering measures, and legislative measures. These are the measures that will be an integrated approach to prevention and control. We call it as multi-pronged attack. Though they are written A, B, C different measures, they go hand in hand. First, let us talk about the medical measures. The first thing in medical control is pre-placement examination. This is the foundation of efficient occupational health service. We do that so that the worker can perform his duties efficiently without any detriment to his health. Now, what do we do there? We take the worker's medical, family, occupational, social history, like what was his previous occupation, how many years he was doing that work, what are his social habits, smoking, alcohol. A thorough history is taken because all this would affect his disease or the hazard that he's going to have in an occupation. Now, a thorough physical examination, including locomotor function, physical capability, mental capability, is conducted. Also, investigations like X-ray, ECG, vision testing, urine, blood examination, audiometry. A proper job analysis should be done for all the jobs. After that, the right person is employed for the right job. That is the main aim of doing a pre-placement examination. For example, a person with color blindness should not be employed as a driver. Now look at this. A person with a normal vision is able to see the red and green color very correctly. He can differentiate the colors. But when a person is color blind, they look all the same, and this can be very dangerous for the driver, not only for him but also for his passengers. Now, person having anemia are unfit for jobs where lead exposure is there. So in an occupation where lead exposure is inevitable, this person should not be given the job. Person with cough and bronchitis or healed tuberculosis is unfit in silica industry because silica causes inflammation and fibrosis in the lungs and can exacerbate the cough and bronchitis which he already has. Now comes the secondary level of prevention, early diagnosis and treatment. So you have to detect the health impairment as early as possible to delay the development of the disease. Medical examination should be done periodically at specific intervals like once a month, once a year, or maybe even once a week, depending upon the toxicity of the exposure. The health professionals must know how to anticipate and recognize the conditions in those who present with symptoms and those who are pre-symptomatic. That is the main aim of the periodical examination. Now, for example, exposure to dust and fibers. Where there is an exposure to dust and fibers, such workers, you should undergo lung function test repeatedly to detect early respiratory impairment. Where there is lead exposure, estimation of core porphyrin in the urine and ALA in the urine. Audiometry for noise exposure, so that early detection can be done, and in that case he could be given a different job where this exposure is not there for some time, or he could be asked to take a leave, or a treatment may be started. Now, healthcare workers, now like this is a healthcare worker, and for them they have to receive influenza vaccine annually to reduce the risk of infection. Medical care of occupational disease is a basic function of an occupational health service. Now, in India, we have the Employees State Insurance Scheme, which provides cash and medical benefit not only for the worker but also for his family. Now, this topic is a very big topic, very important topic. It will be taken in the legislation section. Then we have the notification of data about cases and suspected occupational disease. Under the Factories Act, like there are certain diseases that have to be notified, and it is the responsibility of the medical health service to notify it for taking further steps, necessary steps for the control. Maintenance and analysis of records. The worker's health record has to be maintained regularly, and any occupational disability has to be noted properly, treated, taken care of, and for even future comparisons. Supervision of the working environment. A visit by the physician to the working place to know the environment like temperature, lighting, ventilation, humidity, etc. which definitely has an ill effect on the health of the workers, like we have talked about in our occupational hazard lectures. So a physician has to go around and check for the optimum situations. First aid services and immunization should be made available. Health education and counseling. The workers should be educated for many things like use of protective devices like masks, gloves, apron, boots. They should be taught about the healthy lifestyle like proper rest and sleep, balanced diet, regular exercise, abstinence from smoking and alcohol, because all these will have a detrimental effect on the health. Personal hygiene, hand washing, paring the nails, body cleanliness, they are all very important in counseling. Now, personal hygiene should be again and again reinforced into the worker, because unless we do that, their KAP will not improve. Employees should always follow the relevant work guidelines. They should refrain from eating, drinking, or smoking at the workplace, should wash their hands thoroughly after work and before eating to avoid the chemicals, bacteria, or other harmful substances from getting into the body. Again, abrasions or cut should be managed immediately to reduce the risk of occupational infection. So in short, the elements of occupational health services, you can try to recapitulate. It's pre-placement of fitness for duty examinations, treatment and rehabilitation of the injury and illness, sentinel case detections, surveillance, periodic medical examinations, other periodic examinations, disability review and return to work, health promotion, travel medicine for people with job where they have to travel very often, and record keeping. Now, after we have talked about the medical measures, now let's see what are the engineering measures. Design of the building. Like I told you the first time, they go hand in hand. It's not that we have done the medical measures, it's all over. The engineering measures should also be taken care of along with design of the building. The design of the building has to be kept in mind even before the construction. It should be told to the architect what type of a floor it should be, what should be the ventilation, what should be the room size, windows, cubic spaces. All these things matter. Good housekeeping. For elimination of the occupational hazard, housekeeping is very important, like general cleanliness, lighting, washing arrangements, food arrangements, toilet facilities, general maintenance. Now, ventilation, the general and local exhaust ventilation should be optimum. There should be enough place to admit continuous supply of fresh air. There should be outlets for pollutant air to go out, and there should be an optimum space for individuals in a factory. Mechanization. The plant should be mechanized to the fullest extent to reduce the direct contact of the toxins or exposed dust, so that you can prevent, for example, dermatitis. You're not touching, so you can prevent that. Substitution. Substitution is replacing something that produces a hazard with something that does not produce a hazard. Now, for example, you replace lead-based paint with titanium white. Like we were talking about, lead is toxic, and chronic lead toxicity is a common hazard in the factories, industries. So this lead could be substituted with titanium white. But we have to be careful that to be an effective control, the new product that you are going to substitute should not produce another hazard. Now, another example I'll give you is, now because airborne dust can be hazardous, if a product can be purchased with a larger particle size, the smaller product may effectively be substituted with a larger product. Then dust prevention. The dust prevention, the dust that is produced should be continuously taken out through vacuum cleaning. The walls, ceilings, and passages should be whitewashed at least once a year, with antibacterial paint could be applied. There should be wet mopping. Enclosures and isolation. Some machine, like grinding machinery, should be enclosed to stop the pollution of the air. Isolation, the places where offensive processes is going on, it should be isolated from other workers' exposure. Such operation could be done during the night shift. Yes, protective devices like PPE. It should be again and again reinforced that no one should work without a proper PPE like mask and gloves and gowns. Environmental monitoring. Continuous monitoring for air pollution by the environmental scientists have to be done to see that there should not be any chemicals or dust above the threshold limit of that chemical. And this is a very important thing, otherwise the toxicity is very common. And proper information should be given to the industrialists, and statistical monitoring continuously and research should be done to see that there can be better provision of conditions for the worker so that their hazards could be minimum. These are the engineering measures. Now let's come to the legislation. We'll be talking just about some important ones. The Factories Act. The Factory Act talks about the law regulating labor in the factories. And it has come out for the prime objective of protecting workmen employed against industrial and occupational hazards. And the Act provides for the health, safety, welfare, and other aspects. Then we have the Mines Act. It's a law related to the regulation of rules for the safety of workers in every mine where more than 100 persons are employed. Inspectors are appointed, and notification of accidents have to be done. The owner, agent, or the manager has to remove the dangerous or defective situation as per the directions of the inspector. Adolescents are prohibited from any mining operation. Then we have the Workmen's Compensation Act. It provides for the payment of compensation for injury by accident by certain classes of employees to the workman and to his dependents in the case of his death. So a compensation is paid to the worker or the compensation to the family in case of death. Now we have a very important legislative measure, that's the Employees State Insurance Act. It's a social welfare measure. It is enacted primarily with the objective of providing cash and medical benefit to the workers in different ways, like for sickness, maternity, employment injury, dependents benefit, funeral expenses, and also to make provisions for rehabilitation. The ESI scheme applies not only to the big industries and factories, but it also is applicable to road transports, hotels, restaurants, cinemas, newspapers, shops, educational, medical institutions, etc., wherein 10 or more persons are employed. Provision for recovery of contribution, penalty and damages for default has also been provided as a part of this act. It's a very important subject, ESI Act, which you can read it completely from the textbook. Now, occupational hazard as a term, it signifies both the long-term and short-term risks associated with the workplace environment, and is a field of study within occupational safety and public health. Preventing these hazards is very, very important to the, and is a key to progress and development of any nation. Now, thank you, but let me remind you that please go through all the previous videos that I have posted. So the complete occupational hazards prevention and control, read it again and again, and read some of these Factories Act and ESI Act from the textbook, because this is asked separately as a separate question. Now, after you have completed, there will be an assessment, there will be a small test. This will be informing you. Thank you very much. Be safe and be healthy. See you for the next session. Thank you.